Hello, Evan Laguris here with Illinois Eye Center, here to share my istent inject technique. As you can see, we have markings on the cornea here because this is also a toric lens. Make a paracentesis about 45 degrees from where I sit, which is most comfortable for me for cataract surgery. And then inject epi-sugarcane, followed by viscoat. And I like to hyperfill the chamber for istent inject versus the Gen 1 istent, as I think it aids in the stent releasing from the trocar of the inserter. I also like to do my istents before phaco, as I find it's easier to get the eye to a good pressure, which makes your gonioscopy easier. Make my incision about 1 millimeter anterior to the limbus. I use the viscoat to coat the cornea for view. I tilt the patient comfortably away from me, and then I tilt the microscope about 35 to 40 degrees away from me as well, and that's kind of the angle that you'd like to see. I use a 45-degree gonio prism. We're going to want to mag up quite a bit to get a good view. I insert the inject with the sleeve still covered, and then once I'm clear of the incision, then I'll pull the sleeve back and expose the guide wire and the trocar. Very important to keep the guide wire very centered. A common mistake with early istent inject is too much outward pressure. Just a little bit of outward pressure like that will give you your best insertion, and you're aiming kind of right at the middle of the pigmented TM. Same thing on the other angle here. And again, the mistake is usually too much outward pressure, not enough. If you're not sure if it's in, you can tap it with the side of the trocar. You can see here that these are two well-placed istents. Thank you very much. Happy istenting.